2001 and MD in Kaumarabhritya in 2006 from Government Ayurveda College, Trivandrum. She is a PhD scholar in childhood autism and National Research Awardee in cerebral palsy management. She is currently working as the HOD in Department of Kaumarabhritya in Government Ayurveda College, Thiruvananthapuram. We welcome you, ma'am, for the morning session of Ayurveda diagnosis of disease described in Kaumarabhritya.
Thank you. Morning. Very warm good morning. Shall I start? Today I am given 1.5 hours, a very short time to teach you how to diagnose pediatric illness and moreover how to guide you for the management. I am really privileged to be in front of you for sharing such a session, and I think we'll proceed as it is an informal session. I'll be guiding you and you are free to ask any questions at any time, so that I'm just drawing a sketch on the management protocol. So maybe it is provoking a lot of doubts in you, so you are free to ask any questions at any time. So dealing with a child, it's a different world. They can't speak. They can't narrate what's going on with them. What the discomfort they are feeling, they can't tell you. Their acne is so weak. They can't eat anything as you eat. They are unable to move around. The baby is fully dependent on their mom. They can't adjust to the climatic variations. Even the day and night, the diurnal rhythm, it's not established. They sleep in the daytime and they are awake and active at night. Because while they were walking and they were experiencing a rocking movement during the daytime. So baby loves to sleep in the day, and night when the mom was sleeping, in the intrauterine life, the baby is alert. So after delivery, mom is irritated. Mom is disturbed. Her sleep is gone. Even though baby's sleep is perfect. So an adjustment issue is there, especially for the baby and the family. I don't know whom I should treat. So systemic maturity, as you all know, it's not attained. Even the doshas are in the immature form. It's fluctuating every time. You can't find a status equilibrium phase. And nutrient and vitamin deficiency, vitamin demands vary. It's not as in adults. At different phases of development, the nutrient demands is different. At the time of 1 to 3 months, it's different. It's totally different at the age of 1 year and entirely different at the age of 5 years. So every child is unique. And the immune system is also too weak. Any infection in and around, the baby is prone. Baby is the first to get that infection. And even the clothing, it's too disturbing for the baby. Even the detergents you use for washing the clothing will cause the skin irritation in the baby. So the baby is in the midst of all discomforts, trying to cope up with your world. The main villain is the acne. Immature acne, even the baby is finding difficulty to consume, to metabolize, to assimilate the breast milk. Breast milk is actually a part of the mother-baby unit, even though the baby's acne is so weak to metabolize that breast milk itself. So that's why we call Stanya doshas are there. If the baby was consuming the stanya at the age of 5, we no need to mention about stanya dosha. because we don't mention about Anna doshas. We have the acne to digest different types of Anna. We don't specify idli dosha, vada dosha, chutney dosha. We don't specify. The acne is too weak. That's why we are forced to elaborate the Stanya doshas. So the fluctuating doshic equilibrium, immature Dhatu framework, and the weak acne. Keep in mind the three. So susceptible environment for Ama dosha, Thadugada Ama, Srodoroda, and what all you have studied in the classics, everything you can see in pediatrics. And every disease manifests differently. Even if we are having a fever, you'll be feeling hot in the head, your extremities, everything will be hot, isn't it? But if a baby is having fever, how will you diagnose? Head is hot with cold extremities, isn't it? Padayo shaitya leladasya atitaptada. Why? The baby doesn't know how to manage the temperature. So disease manifestations too differ. And complications, the Bhedavastha is very quick. The Chaya Koba, the phases of Samprapti is very quick. It goes into complications within seconds or minutes. So again, to manage the disease, the selection of the drugs, a lot of restrictions regarding the drug selections. And lot of restrictions regarding the kalpanas which we use. Can we give a Swarasa kalpana to a baby? No. Can we give a Chitraka, Gugulu, like high-potent drugs? No. Our weapons are restricted. Our modes of administration are limited. Even if we give internally a medication, acne is weak. How can the baby assimilate that medication? So, our weapons are becoming weak, and the baby's disease is gaining the potency. So drug absorption, tolerance to a drug, and drug interaction, and toxicity, everything varies. So selection of strategies differ, and the pediatric age is contraindicated for Panchagama therapies, most of the Panchagama therapies. So handle the child with utmost care. That's my first one. And today I am planning give a small description of how to manage a colic, then fever management, then as my dear student Jeevan has told me, a little bit sketching on the autism spectrum disorders, and a bit on seizure management. We'll see how much we can finish today. Coming to abdominal colic, the most common complaint when you are managing a child. Usually acute colics are more severe and it demands more emergency management. Usually appendicitis, intussusception, volvulus, ulcerative colitis, pancreatitis, hepatitis, cholecystitis, renal issues. Even though acute issues are there, it comes only around to 4 to 5% of colic, abdominal colics. So emergency management is mandatory only in 5% of abdominal colic. So rest 95 comes in our court. We are fully equipped or more equipped than any other practitioner to manage a chronic abdominal colic. And to speak an outset, functional colics are more common in pediatric population than structural abnormalities. Reason for abdominal colics are usually functional, and Ayurveda being concentrating more on the functional correction, So we are more equipped. I feel, every moment I feel that we are more equipped than any other field. I am working in a hospital. I am working in Government Ayurveda College, Trivandrum, and we have a separate wing for women and children hospital. It's a separate wing from the main college, and there we have a facility for Ayurvedic management, and parallelly there is an allopathic wing also. So any patient coming into that hospital, any child coming into that hospital has full freedom to select any stream of science. At the OP counter, the baby is, not the baby, the mom has the freedom to select either Ayurvedic or allopathic. So every time, every moment we are bound to project the dignity and efficacy of our science in front of the patients and as well in front of my students. So functional colics, functional abdominal colics, which comes around more than 92% of total colics. So it's the bread and butter of every pediatrician. Main reasons are worm infestations. Even though we won't find a worm in and around the anus, or we won't find a perianal itching, worm infestations are most commonly the most common cause of intestinal colics. Then comes lactose intolerance. Even though the parents won't admit that the baby is having lactose intolerance, because everyone is prone to feed the baby with at least 2 cups of milk every day. After the breastfeeding has weaned off, the inborn tendency of every Indian is to feed the baby with pure cow's milk, at least the cow's milk, the packeted milk. But the lactose intolerance is very much prevalent in Indian population, that from the next day itself, have a check on whether the baby is having a lactose intolerance, or whether the baby is finding difficult to digest that guru shira, and that gurutva in the shira is causing an achnimandya in the baby, and that achnimandya is the root cause of intestinal colic. So the first thing is worm infestation should come to your mind, and second is the achnimandya, and main villain may be the milk, the lactose intolerance. Then aerophagia, usually in kids who are bottle fed, gulping the bottle or soothers given in the mouth. So aerophagia is more common in bottle fed babies. So if the baby is bottle fed, think of it first. Then constipation. Constipation is very common complaint after 3 to 4 months of age. And the first thing you should think of, if a baby is complaining of constipation more than 2 days coming to you in the OP, just don't go for a laxative. Ask them whether the stool is hard pellet-like or it is sticky stools. If it is hard pellet-like stool, we should think that something Vadakoba is there, and we can directly go for a Snigdhada. But make sure that if the stool is sticky and it's difficult to wash it from the nappy, it's the first and foremost sign of, can I get the answer? Amavastha, and usually associated. That's right, Amavastha, and it's usually associated with which disease? Achnimandya is there. Sure, Amavastha is there. Achnimandya is the main feature of an endocrine disorder, which is an usual presentation in childhood. Nowadays, the prevalence is increasing. Endocrine disorder. Hypothyroidism, that's the answer. It's a main feature of hypothyroidism. Its prevalence is alarmingly increased nowadays. The main feature is mother will be complaining that baby is having constipation, and baby is gaining weight every day, so mom will be happy, but the stools are sticky. Only that's the complaint. When you palpate the anterior fontanelle, you will feel that it's wide open than the expected. Even at the age of 1 year, it's not closed. Even though baby is not consuming much food, baby is gaining weight. It's a little bit floppy baby. Think of hypothyroidism whenever you get a case of constipation with sticky stools. The stools won't be a hard pellet like, it's sticky like. You are very correct that underlying ama and Agni is there. You should go, treatment management should go on that line itself. Then GERD is there, gastritis is there, then mobility issues is there, bloated abdomen. Now, I am viewing all these abdominal colics from a perfect Ayurvedic platform. So I'll differentiate every abdominal colic as Vadiga and Kabacha. Paitiga I'll keep aside because it's little bit more dangerous than Vada Kabacha. So we'll see the Vadiga first. The pain, colic is usually intermittent. Baby will be feeling healthy in between. A bout of pain will be there and a normal period will be there. Again another bout after a certain period. That intermittent character is the typical of Vadiga Shula. Then usually baby will be an associated feature of constipation. Constipation won't be the main complaint, but if you go on taking the history, baby will be having a constipation. And the pain will be usually felt in the lower quadrants of the abdomen than the upper quadrant, because Pakvasya is the seat of Vata. Lower quadrants will be having pain, and make sure that there is no tenderness. Tenderness is absent in Vadiga Shula. Only pain is there. And the abdomen will be blotted. The resonant, it will be more resonant on percussion. And you can feel that if you have a little bit of warm soup or something, baby will finding a relief. He won't be complaining of pain after. You should go on asking the history, take the history very relevantly, because mother will remember only the time when the baby is having the pain. She won't remember the time when he's getting relief. So you should go on asking whether he had the pain within an hour after having food. If you go on taking the history clearly, she will say that, no, after food he went to sleep. And after waking from sleep, he was irritated. He woke up from sleep like complaining that he had pain. That's a typical Vadiga Shula. Then, am I going fast? Is it okay? Then coming to Kabaja Shula. Baby will be having more salivation, nauseating feeling. Even though he is not vomiting, that nausea, that salivation will be there. Baby will be reluctant to have food. That abhishyanda feeling is everywhere. He'll be doing like this, rubbing the eyes, nose, a little bit wet, slimy feeling everywhere in the Navadwara. And you feel like a bit of running nose, more salivation, reluctant to have feed, everything is there. And on palpation, you will feel a vague tenderness. He cannot point out that area of tenderness, but he will find, it's paining. Here also it's paining. Everywhere it's paining. And bit more pain or tenderness is experienced on the epigastrium. And comparatively, the lower quadrants are free. Typically, it is pain, not the tenderness, a bit of tenderness. In Vadiga Shula, tenderness is perfectly absent. In Kabaja Shula, 1+ and more in the upper quadrants. And baby is reluctant to have the food, and if we forcibly feed the baby, he is finding more discomfort. I feel like vomiting. It's a usual presentation. I don't want food because it feels like vomiting after the food intake. And tenesmus is also a classical feature. Feeling that he has not evacuated fully. Then coming to Paitiga Shula. More than pain, tenderness is the feature. Tenderness is the feature. Baby will be sitting quietly or lying down quietly somewhere to avoid the movements, because every movement may cause a discomfort. He won't allow you to touch her belly because it's tender. So don't go for a deep palpation, just give a soothing rub the abdomen and feel where is the warmth. Where can you feel the warmth? You can feel the warmth in the abdomen. In Vadika and Kabaja Shula, when you are free to palpate, baby is allowed to palpate, and comparatively the abdomen you feel more cool than the upper body. But here, more warmth will be there and the baby will resist palpation. You can mark out a typical area of tenderness also. And if you go for if you are coming to an Paithika Shula, definitely go for an USG. Don't waste your time, go for an ultrasound examination, ultrasound abdomen. And lymphadenitis is usual presentation. Misandric lymphadenitis is an usual presentation. Usually it's associated with fever, and loose stools is it's not perfect Adhisara, loose stools and discolored stools will be there. Usually a little bit on the greenish tinge, discolored stools will be there. And baby doesn't need food, not that it's nauseating. She's so sick that she don't demand a food. And even if you feed the baby, she's not finding it comfortable. And if the baby is a bit younger, a bit older, you can feel that it aggravates with spicy food. Baby, the tenderness is so exaggerated that the baby is uncontrolled now. So every Paithika Uddara Shula, beware that it's an acute condition and go for investigation within minutes. And the red flag signs are acute and severe colic, any bleeds, any red blood tinge in the fecal matter, usually intussusception, that's the main, intussusception, volvulus, gastritis, then severe gastritis, ulcerations, everything should go into our mind. And when it feels on the right quadrant, appendicitis, fever, everything should go. Paithika Uddara Shulas are mostly organic. Even though it comes less than 5%, it's mostly organic. So it usually needs an emergency management. It's an inflammatory, organic, structural lesion inside. More than a functional derangement, there is a structural inflammatory pathology inside, which demands more emergency management. It's not that we cannot manage, but we should be quick on that. Don't waste a single minute on Paithika Shula. So coming to management. I think you're comfortable with it? So infantile colic, the main principle behind is Vata Anulomana, because everyone knows that Vata is the main villain causing the Shula. And when the baby grows beyond the age of 3 years, baby develops Uddara Shula, abdominal pain before going to school. Haven't you seen that? Especially at the period of after 7 o'clock, baby will develop Uddara Shula. How to manage? How to manage? Should respect the behavioral problems going on in that baby. Don't make fun of the baby. Baby is trying hard to adapt with the needs of the parents. Actually, it's not a fake colic. It's actually, you all have felt that colic, isn't it? I have felt it. I have felt that nauseating feeling. Something going on in my stomach. I feel like going to toilet. When getting into the school bus, I feel like vomiting. Actually, I had felt it. If a doctor is ignoring my complaint, it's too bad. Support the baby, support the behavioral issues that's going on in the baby, support the acne mandya caused due to that behavioral issues. Manage it and don't disrespect. Respect that and manage it accordingly. Usually all that 7 o'clock colics are kabajashulas. So manage it with Ashtachurna is the best option for that. Ashtachurna with a little bit of lemon juice, ginger juice and honey is the best remedy for that. Or you can give a water boiled with nagara also. That's also another option. Ashtachurna with a little bit of lemon juice, ginger juice and honey is the best remedy for that. Keep the breakfast very light. Don't give milk during the morning hours. Make it too light. Avoid biscuits. Avoid anything and everything made out of white flour. And give a Deepana drug in the morning. Make sure that baby is having at least a 45-minute gap between the breakfast and the travel to school. Because it's a reflection of the acne on the mental faculties. Don't feel that acne is having its reflection only in the Sharira doshas. It has its definite reflection in the Manasika doshas too. Rasadhadu Dushti is keeping the mind disturbed. Correct the acne. And the behavioral issues is the way of the child to ventilate that I am finding is difficult at school. If babies are not ventilating their frustrations, bear in mind that the baby is more prone to develop behavioral issues in later life. Ventilating our emotions is a need of each and everyone. I feel happy, I smile it out. I feel distressed, I do something. I'm not pleased. I show it on my face. If you are not able to ventilate your emotions, it doesn't mean that your sattva-guna is more and you smile every time. Your internal struggle is more and it will reflect somewhere in your body. So, keep the mother educated that baby is finding it difficult somewhere in the school. Inquire what's going on or give a little bit consolation and more care for the baby. Correct the acne and you give proper prescription. Is it okay? Then coming to Udarashula, decide the dosha vitiation, what's happening. And also the site of dosha dushti should be marked out. Usually whether it is in the Amasya or Pakvasya. Usually Kabaja Udarashulas come from the Amasya, usually, and Vadika come from the Pakvasya. Judiciously select the drug and the mode of administration, the Kalpana you use also shared. Confirm that the drug is available, the original drug is available. Don't simply go for Dashamula Kashayam. Every time when I see a prescription with Dashamula, I am really afraid how many mulas are really available. So, check the genuinity of the drug. It's not that you need a Behukalpa. You need a single drug is enough, but be sure that the drug is genuine and hygienic. Always try to avoid Swarasa in younger ages. If the baby is below 1 year, better to avoid Swarasa, better to avoid Kalka and no to Arishta Asavas. Because Arishta Asava Kalpana, even if in any type of dosha vitiation, more than the action of the drug, the Kalpana is bound to create an gastritis. So even if it's Vadiga Udarashula, you will make it Vada Paitiga Udarashula. Even with Swarasa, you will make it more Paitiga. So don't make it complicated. Better to avoid Swarasa, Kalka and Aristasava Kalpanas. And even if in older children, better to mix Arista with a little bit water, or either with Kashaya, also make it dilute. Churna Kalpana is the best selection, Kalpana selection, when Kleda is more. Churna is Ruksha, you can compare the Kleda. So in which dosha Kleda will be more? What about Pitta? You don't like it? Kleda is more in Kaba and Pitta. Pitta Visheshan also Kleda is there. Kleda is absent only in Vadic, typical Vadika Visheshan. So Churna Kalpana is more utilized in pediatric population because it's Kaba Praya Avastha. Then Kashaya modifications in Kerala traditional practice, we use Kashaya modifications because by simply giving a Kashaya, baby it will be not a good taste. Na? Baby will be avoiding other food, at least due to a distaste of Kashaya, baby will not be having other food. So make it the Kashaya a little bit nutrient also. So if the Vyati is, the disease is Paitiga, or if baby is having a little bit Agni Deepti, go for a Kshira Kashaya. Don't add much milk, but add a little bit milk. Reduce the quantity of milk, but make sure that it's providing a little bit nutrition also. And my favorite is Kairika Kashaya. Every time I go for that. Kairika Kashaya is a decoction made with tender coconut water. Tender coconut water. Are you familiar with that preparation? It's a traditional Kerala style practice in pediatric practice. Kerala style in pediatric practice. We chop off a tender coconut, remove that upper part, put the Kashaya Dravya in the tender coconut, seal it again, tie it tightly, keep it in a boiler or something, cook the coconut as a whole, tender coconut as a whole. After cooking it for 15 minutes or so, we drain out the fluid, drain out the coconut water, so that that coconut water is boiled with that Kashaya Dravya. It's so sweet and nutrient. Pitta Shamana, Shida, Jwarahara, Mutrala, Shobahara, what else? So it's the best option, best method of application. You can increase the palatability of the formulation, you can increase the nutrient value. It's so lekhu, mutrala, it's very tasty actually. Every child like to have it. They'll go on asking, Mom, I need the morning kashaya. Otherwise, no baby will ask for your kashaya anyway. Pardon, I didn't get you, ma'am. Yeah. Yeah. That's a very nice question. I got her. She asked me that whether the raw drug is not available and you have only the prepared kashaya with you, can you add the prepared kashaya, is it clear, with the tender coconut? To be frank, I always avoid a prepared kashaya for a baby under 6 years. Because prepared kashaya, how will you prepare? Make it concentrated and add? That is too pittala. That sodium benzoate and any preservative I won't accept. So I prefer a freshly prepared kashaya. I won't go for a prepared one in a pediatric practice. Strictly, even if you don't give, I am okay. But I won't go for a kashaya. You can go for another kalpana. So you have the churna, you have the gulika, anything you have. But don't go for a prepared kashaya if the baby is under 6 years. Better avoid. Aravindasavam and all, I mixed with some, for managing Shula, I won't give typically concentrated Aravindas or anything. After 6 years, it's okay. The mucosa is a little bit more tough. It's okay. Even if you are not getting the fresh drugs, you can have the kashaya churnas available. in the market. Kashaya Churna, it's easily available in the market. You can have it. And if it is tough for you to cook the coconut as such, you can drain the coconut water from the coconut and cook it in, make the kashaya from it. But the other thing is more palatable and more effective than cooking it with coconut water alone. Shelf life of the preparation is only 6 hours maximum. It's ready to make. You can make in other way, ma'am. I have made like, you can select the Gopi Chandanadi Churna. I have made it in a different way with Karika Kashaya. I collected Gopi Chandanadi is a preparation usually used for management of skin lesion in children. The drugs used in skin lesions are usually Pitta Kashaya drugs, because skin lesions are usually, using type skin lesions are usually Pitta Kabaja type. So for managing the Pitta Kaba lesion, I am bound to select a drugs having Kashaya Tikta Rasa. So palatability comes to 0. So I should seek for another option to administer the drug. So I tried in Gopi Chandanadi, collected the drugs for Gopi Chandanadi. I collected 100 Gopi Chandanadi Gulika from the market, powdered it very nicely, put in the tender coconut, then sealed it, baked it the other way which I mentioned, drained out, and I got a semi-solid. It's not liquid-like, because I added 100 Gopi Chandanadi Gulika. It was something like semi-solid. I dried it in the shade, then again powdered it. Now I got Gopi Chandanadi Karika Kashaya powder, having a shelf life more than 6 months. Yes, ma'am. No, I usually prepare, put the drugs in that the karika, then contain the coconut, cover it, bake that full in the cooker, and then drain it out. For that, no reduction in the quantity is mandatory. Just cook it for 15 minutes. That's enough. If you are preparing the otherwise, just boil it for 10 minutes. That's enough. No need to reduce it. Be sure that you are cooking in very low flame. Don't increase the flame. But the first one is more palatable and more effective than the second method of preparation. I think I am going slow. And then comes the Arka preparation, another main important tool for a pediatrician. Arka Kalpana you are all familiar with. No need to explain more. So think of an Arka when you are planning for a kashaya. So palatability will be more, the dose is less, and the effect is not compromised. Think for an Arka. Then Fanda Kashaya is also a nice option when you are thinking of Swarasa. When you are planning to give a Swarasa, boil the water, dip that leaves in that, cover it, and drain off the fluid. That's Fanda Kashaya is a good option. And respect the subcutaneous route of drug administration, the most powerful route in a kid. Go for lepanas, go for dara, go for abhyanga. More effective than oral administration. Oral administration, acne is so weak. Even if we give a miracle wonder drug, baby should assimilate now. Then only it will work. Go for subcutaneous absorption. That's more. In Paitiga Udarashula, rely on lepanas. That's wonderful. Even for pneumonia management, Arogya Kalpadruma is a traditional Kerala practice text on pediatric practice. They have related for every disease, lepanas are told. It's very nice if you have a copy with you, personal copy with you. Even for pneumonia management, they have told a wonderful lepana to be applied on the chest. I use it in my daily practice and I have very good result with this. Arogya Kalpadruma. It is an English translation is also available. Arogya Kalpadruma is a traditional Kerala Balachigilsa text. Apart from, I manage it like Kaba Paitiga Jwara, and I will detail it. And LEPA is an integral part of that management. I will narrate it, ma'am. Then rectal suppositories, wonderful, wonderful, another route of administration. I made a suppository with Hingu Vajadi Churna and Gula, wonderful in colic management. And I have another one with Sudarshana rectal suppository, even though it looks crude because I make it myself with a little bit beeswax. So, but effect is wonderful. Otherwise, babies won't be consuming Sudarshana Churna. It's too, palatability is too bad. So even though the results are very nice, babies will be reluctant to have that. So make it a suppository. Vadika Udarashula. Nayopayam is the first kashaya, drug of option. If it is bit more in the upper quadrant, Gandharvastadi is the drug of option. Make sure that you are adding a little bit Saindava in that. If the lower quadrant is blotted, then Jerd is the Resonati is very nice. Make sure that you are adding Leshuna after keeping it in Takra for 1 day. Don't add pure perfect Leshuna to that. Saptasaram is a good option mixed with Saindava and Gula. If a full lower quadrant is aching a little bit, aching pain in the hip joints and also. So radiating pain is the Saptasara is a good option. Then Hingu Vajadi Churna is my favorite. Add a little of Lavana Bhaskara Churna whenever you need to add a little bit Saindava. Substitute it with Lavana Bhaskara Churna. Arkam with Shadahua, Ajamoja and Nagara should be there in the hand of every pediatrician to manage a colic. Gandharvarandam can be added to relieve that, to make sure that Vada Anilomana is the Abhyanga and Sweda, mandatory, because Vada is vitiated. Subcutaneous absorption is very nice. Make sure that you are doing a clockwise Abhyanga. And Pada Sweda is more advised. Padasveda or Hastasveda if the baby is below 3 months. Padasveda is very nice. Avoid moist heat. Dry heat is the best. Kapacha Udarashula. Then Ashtachurna with honey if it's Amasya. Vaishwanara if it's Pakvasya. Nagarapanaga always advised. Tripala Churna is another wonderful drug. Kledahara, Tridoshahara and Anulomana. Kledahara and Anulomana, that's two difficult things which you have to achieve in every pediatric practice. So this is a wonderful combination. Tripala Churna is both Kledahara and Anulomana. Vilvadi Guliga, beware of Ama Visha. So whenever you see an Aknimandya with Kabaja Aknimandya, you see an abdominal colic, it's lasting for more than 3-4 days. Make in mind that you suspect an Amavisha and give an Vilvadi along with that. Here is the field you can use Arishta Asavas. You can combine Arishta Asava with little bit of Kashaya, that's okay. Abhay Arishta and Danti Arishtas are other options. Chiri Vilvadi Kashaya is advised only if the baby is above 7 years. It's Saindava and Gula, because I am afraid of that acne in that. Even though I can compromise the Dashamula, I am pleased with the functional correction of Dashamula, Kadatraya, Kashaya and Udarashula. Paitiga Udarashula says I am skipping it fast? No, it's okay. Am I slow? Abhyarishta for Kabaja Shula, sir. When it's a little bit constipation, tenesmus is there, you can mix it with the Kashaya and have it. After 5 years. If it is perfectly Kabajashula, I can start it from 3 years onwards, because Kaba is so intense, and you can be sure that no Pitta vitiation will be there. I won't advise Arishta in babies less than that age. But if you are damn sure that Pitta won't be vitiated, because that much Kabadushti is there, and you need to make it little bit more tikshna, you can use it, but it's very personalized. I won't teach my students to advise Arishtas below 5 years. If you have, it's perfect Kabaja Koshta, you can have it. Paithika Udarashilas are usually inflammatory bowel diseases, so you should think of gastritis, gastric ulcers, colitis, hepatitis, pancreatitis, appendicitis, ulcerative colitis in that. All itis. So whenever there is an itis, Ushna Guna is more, Kleda is more, Ama Pitta is there. So think of a drug which is Shida, which is Ruksha. The drug which is Agria for Shida, having a Shida and Ruksha Guna, is Chandana. So Chandana Churna is my best, is my favorite for managing Paithika Shula. That is combating the vitiated guna with the opposite gunas. Every time in a Paithika Shula, Ushnatva, Amatva will be there, Ushna Snigdha will be more, so combat it with Shida Ruksha drug. Chandana is the Agriya Drevya for Shida Ruksha. Chandana Churna, Sudarshana Churna is another short medicine, but the palatability is very less. Chandana Churna palatability is very good. That's a merit of that drug. Avipatti Churna is Akni Dibana 2 and Anilobana also. Then I can think of Padaladi Kashaya. Padaladi is usually advised in hepatic spectrum. Drakshadi Kashaya is the very nice Pitta Shamana and palatable and very nice flavor also. When nausea is associated, you can go for a Drakshadi. Guluchiyadi is also the Panchatikta is more Pitta Shamana. Even though palatability is not so nice, if you are making a Karika Kashaya with Panchatiktaka, that's the best drug. Anupana is always a little bit of what they call sugar, because Chandana Churna is very palatable, ma'am. You don't need anything. Just mix it a little bit of water, apply it on the tongue, apply it on the area which is affected. The Lepana will give more results than in tongue. A pinch of Churna is enough. The drug dose is also very less. You can have it 3 to 4 times a day. It's in Kerala, it's available with the Aushadhi, so we get it easily in the hospitals. Pravala Basma and Shanga Basma is very nice to manage the acute stages. As I told, don't forget the scope of Lepana and Dara. Shweta Chandana. Shweta Chandana. Shweta Chandana is the best option. Rakta Chandana is not told. Pardon, I didn't get you, ma'am. For Paithika Udara Shula. Shulas. I use the labas which is easily available in my hospital. Sudarshana Churna is available in a very big quantity in my hospital, and all the kids, they don't like to use it, have it internally. So I use it regularly for external application. It's very nice externally. If you have a very good drug resource with you, then Shatavari and Amlaki Lepana is very nice. Every Lepana should be applied in milk. Paithika Udarashula, it should be applied in milk. Or you can have butter with that. Butter, applying Lepana with butter is also very nice. If If you are applying Lebana in Kaba, Takra is the best medium. So shall I wind the abdominal colic? Coming to fever management. Next, I have one mirror on the back side of the stage. My dear husband is there. So every time I go narrating, I look at his face whether I am okay or not. So coming to Jwara Chikitsa. Fever management. First, being a pediatrician, you should know how to assess the severity of fever. As I told earlier, Laladasya aditaptada and padayo shaityam is the. When you feel a cold extremity, suspect that something is going on wrong in the body. How will you measure the fever? With a thermometer? Is it okay? Where to place? Yeah. Axillary. Baby is finding too difficult to disperse the temperature. That's why Padayo Shaityada is the. Axillary temperature won't be reliable. Rectal. Here comes. Rectal thermometer is a reliable one. Don't rely on the axillary temperature. Rectal is the one. And I have another tool with me. Because I have more than 150 kids a day, and every time I go for a rectal thermometer, it's too tough for me. So I use this one. Non-contact infrared thermometer. That's a small gun, like it costs around 1,500. Can you see the picture on the lower one? Can keep it away from the baby. Just press it for 1 second, it will read the temperature. It can be used in any practice, not only in pediatric practice. Because every babies, they are afraid of this thermometer. Anything needle like they are afraid of. Even if it's not paining if you keep it under axilla, but they are afraid of. Their pulse comes up, they cry a lot. So with this one, I can measure the temperature of anything and everything. It's not only for human temperature measurement. You can measure the temperature of Vastidravya with that. Change it into object mode and measure. Change it into human mode and measure the temperature of human. If we can, by judging the Uttara Shula, if the baby is not allowing me to palpate the abdomen, check that warmth is increased anywhere. I can check it with this. So it's a child-friendly temperature measurement. And another instrument with me is pulse oximeter. Everyone you are familiar with, isn't it? Because if the oxygen level goes beyond 90, I won't be knowing until and unless cyanosis is setting in. So I have a pediatric ward of 70 bed strength at my hospital, and more than 95% of kids are having development disabilities, because all my higher education is on managing the development disabilities in children. I had my PG work on management of cerebral palsy. I had my PhD work on management of childhood autism. So my beds are usually filled with kids with development disabilities, more vulnerable than the ordinary kids. So every time I should be equipped with more instruments so that I should judge every fluctuation in the Doshic equilibrium. So every time I don't keep the steth on the chest. I'll use the pulse oximeter, then I'll guide the infrared thermometer, and then go for the steth. And your stethoscope should be of higher specification. Otherwise, you can't read it. So it's always advised to spend a 20,000 or 25,000 on your steth. It's not a waste in pediatric practice. Don't go for a low quality stethoscope. This one is a pulse oximeter. Be sure that you have, as you are not pediatricians in general, anyone who completed the Kaumarapatya PG? No. So if you are a general practitioner, can have a pulse oximeter having a dual probe. Dual probe means you can have an adult finger in that, also a pediatric finger. That costs around 2,500. If it's pediatric alone or adult alone, it will cost around 1,500. So if the baby is coming you with fever, locate the focus of the fever. Fever is just a sign. It has a reason behind. So locate the focus. Every time speak to the mom, keeping in search of the focus of the fever. It may be an upper respiratory, it may be a lower respiratory infection, it may be an ER discharge, it may be a diarrhea, vomiting, maybe urinary infection. Baby won't be feeling dysuria. Bear in mind, they won't be complaining of any urinary problems. Urinary tract infection is very common. So if you are not getting any focus, go for an urine routine. Then any rash, jaundice, arthralgia, contact with fever cases, recent vaccinations, everything you should come to your mind. Investigate. If you are able to find a focus, well and nice, no need to investigate. If you are not sure about the focus, better go for an investigation. And if the lower respiratory infection is a little bit in a serious condition, better go for an investigation. Don't wait to the normal protocol for investigating every case after 4 days of fever. It's dangerous in pediatric population. If you are very sure about the focus of the fever, no need for investigation. Everything, every sign and symptom is accordance with your assumption, no need for an investigation. If something is, some foul smell is there somewhere, better to investigate. Don't wait for 4 days for an investigation. When you go for an investigation, go for a thorough blood picture. You cannot order the baby to have a blood routine today and another investigation in the blood after 2 days, because it's paining for the baby. So whatever investigation regarding the blood you want, do it a single day itself. And you are suspecting some other cases, you can go for X-ray, wide and all. It's not a routine protocol. Every time if you do a blood routine, blood investigation, always go for a bilirubin test also, because it may be, its feature may be hidden. And hepatitis is very common nowadays. So we'll go for HP, TZ, DC, ESR, C-reactive protein, then platelet count. Why? Because dengue is very common nowadays, bilirubin also, and urine routine. That other is not mandatory. General prescription and description of a viral fever. Viral fevers are very silly fevers usually, because severe viral fevers are there, but usually viral fevers are calm, quiet, silly guys. So obedient ones. If you give an antipyretic, it will obey your command. It will come down and touch the normal line. After 4 to 5 hours, again it's naughty. Again increase the temperature, but again if you give an antibiotic, it come down and touch the normal line. And the baby is very happy in between. Baby is very cheerful, active, and mother will narrate that, oh, he is coming to bed only when the fever is having a spike. Otherwise he is very active. That's a typical presentation of viral fever. Temperature comes near baseline with all antipyretics. Usually temperature won't go above 102, remains afebrile till the next dose, clinically well during the afebrile periods. Fever subsides within 3 to 4 days. No biphasic fever pattern usually. Spikes are not much. And the other type is bacterial fevers. Non obedient guys. Even if you give the antipyretic, it won't touch the normal line. Resistance is there. It will reach maximum up till 100 degree. Again, within 3-4 hours, it will shoot up and go for 1 or 3, 4 like that. Go investigate the case. Just don't rely on your drugs. Investigate the case. Because bacterial infection is uh, prone to have complications more than the viral ones, usually. Fever doesn't touch the baseline. Fever occurs within every 4 hours, it's recurring. Baby is sick actually. Throughout the fever period, baby is sick. Even if the temperature is touching 100, he is not active. He is sick. Then total count above 15,000, absolute neutrophils above 5,000, ESR, CRP, everything raised. That's the indication of malarial fever. Your first and foremost duty is control the temperature, irrespective of whether it's viral, bacterial, any dosha, control the temperature. That's your first aim. It's not that aim in adult fever management. But in pediatric fever management, baby is unable to control the temperature. Baby is finding it difficult to disseminate the temperature out of the body. Adults are they are very tricky, they are very expert. They can manage the temperature by splitting it, disseminating in the full body. In the baby, the core temperature is increasing. So, brain is more prone to have the result of fever. So, febrile seizure is the classical feature of pediatric practice. Beware of that febrile seizure. Even though febrile seizure won't have much complication, but parents doesn't like that. If you are managing a fever baby and the baby is developing a febrile convulsion, that's the last time they are coming to you. They won't come to you. The family won't come to you anymore. So beware of febrile convulsion each and every time when you are managing a fever. So management of febrile convulsion is management of temperature. So don't rely on the oral route. Rely on the subcutaneous route. Go for talam. That's the best way. Go for lepa. Go for talam. Acne is manda. Don't go for the internal. For managing the temperature, sponging can be done. Sponging in the forehead, sponging in the axilla, and in and around the neck, groin, you can do sponging. Then go for talam. Talam, should I detail? Talam is an application of medicated paste on the anterior fontanel. Because you can manipulate the brain and the endocrine system with the talam, the master controlling systems of the body. Because anterior fontanel is very much open in kids. Anything and everything applied on the anterior fontanel has an easy absorption, bypassing all other routes. So, talam or application of medicated paste on the anterior fontanel is widely used for infanticide. Poisonous medicated paste like Langali is made into paste with plain water and applied on the anterior fontanelle, and baby will be showing reduced respiratory rate and cardiac rate, and baby will be surrendering to death within 3 hours. So that much powerful is the that route of administration. So talam is the best way. Kachuradi is the usual powder which we get in Kerala. That's Pitta Shamana, and you can apply, mix it in either milk or with Karpooravalli. Are you familiar with? It's locally available plant in Kerala, Karpooravalli. We call in Malayalam it's Panikurka or Navara. Apply in the swarasa of, mix it with the swarasa of Karpooravalli and make it a paste and apply it on anterior fontanel. It's very good to reduce the temperature. If upper respiratory infection is also the Shigra Swarasa and Krishnadi Guliga is that. Krishnadi, if not familiar with. I usually prepare a paste of dried powder of aloe vera and with Shigrus verasa and apply it on the antirefontanel and make bindi out of that every day. If the baby is having abhishanda or baby is a kaba prakriti. Like bindi out of that. It's very nice to see because it's black in color and all moms like that. And it's Kledahara, Shobahara and Kabahara. Not skin irritation also because aloe vera is main ingredient. And I advise you use the dry powder of that to be sprinkled on the antirefontanel after bath also. That's also nice. It's not advised to use Rasnadi Churna in younger kids. Increase the fluid intake because the only route to manage the fever, manage the temperature is increasing the urine output. So increase the fluid intake. Single drug, my favorite is Kadigrohini Churna. Even though Mustaparpadaga Jwara is told everywhere, I have no a single case experience managing the fever with Mustaparpadaga. Do you have the experience? Mustaparpadaga alone? Mustaparpadaga alone, I don't have an experience. Chadanga is very nice, but Mustaparpadaga, I don't feel it's so potent. Maybe it's Amapajana and it can work somewhere else, but managing fever, managing temperature, Kadigrohini is my best friend. If the baby is breastfed, do a Stanalepana with Kadigrohini and then feed the baby. Nagaradhanyaka Panaka can be advised. Arkakalpana is also advised in fever management. This one shall I skip? There's one. I think more yogas are available only in Kerala tradition. Aranya Tulasyadi is Tulsi you are familiar with. Then Vishnu Krandi, what's the name? Aranya Tulasi Moolam, Vishnu Krandi, Mahaushadam. Only 3 drugs are there. Vishnu Krandi, they will refer the botanical name and let you know. Only 3 drugs. Very effective combination in managing viral fevers. My favorite one. During the viral fever episode, I make an arka out of Aranya Tulasi, these 3 drugs and make it prepared in my hospital. Drakshadi Kashaya is the best option when it's associated with nausea. Amritottaram, if the baby is having fever with Ama Lakshana more than Amritottara Kashaya, then Pajanamrita again a Kerala traditional combination. Kadamba. Evolvulus. Convolvulus pluricalis, that's the drug. No, adalla. Evolvulus alcinoids. Aparajita. Pardon? Oh, sure, ma'am. Kadigrohini Churna, dry leaves are usually not available, ma'am. We get only fresh is not available. We get only the dried ones. We make a powder of that, mix it with, make a paste out of Keep it for 30 minutes, wash it off and feed the baby. Otherwise, the drug dose which is going into is too much. We can't judge. Wash it off and then feed the baby. All Stanalebas are like that. Apply on the breast like it's Muhurtam lebe, that's the vidhi. Apply for 45 minutes. I usually apply only for 30 minutes because it gets dried up very easily. On keeping like 45 minutes, it won't go like that. I keep it for 30 minutes. When I ask them, when it's get dried up, wash it off and then feed the baby. It's not advised, never advised to feed the baby with the paste on that, because a pinch of Kadagrohini Churna is the drug dose. If you apply it over the breast and then feed the baby, a lot more will go in, and it's too rechana. Don't never advise that. Bala Chadurbhadra Rasa is a very wonderful weapon. Should be with every pediatrician. Not the syrup, the actual one. You should prepare it. Make sure that Adivisha is genuine. Then red flag signs. If the pulse rate is increasing disproportionately, with every 1 degree, you should have a 10 increase in 10 pulse. But if it is temperature is very low and the pulse is increasing without limit, beware. And disproportionate increasing respiratory rate, it's a red flag. Check out for the pneumonia, neck stiffness, meningitis, tensed anterior fontanelle, something going on in the brain, impending shock, extremely cold extremities, toxic signs. Investigate rougher. The child is more precious than our science. Respect the child than our science. Recurrent fever, immunocompromised, Agnimantia, Srodoroda, Kleda, everyone present. So, skip the fever management protocols. Preserve the fever management protocol only during the acute episodes. Go for Amahara, Srodashodanatva in between the phases. So, Patyahara should be obeyed. Strict regulations, not on the don'ts. Advise the do's. Because if you skip everything and mom will be embarrassed what to give. So, stress on what all you can give and just brief that you should avoid this much. It's our habit to stress on what not to give. And all that nots are very favorite for the child also. We'll advise not to give ice cream, not to give chocolate, not to give non-veg, not to give fried items, not to give. So, better to advise what we can give. Recurrent fever, immunocompromised, Chavanaprasha Kashaya is my favorite. Chavanaprasha Lehya, that Kalpana is Guru. Agnimandia is the, I will prefer a Kashaya Kalpana. So have the drugs, make a Kashaya. If Karika Kashaya, it's very nice. If otherwise also, it's palatable. Have it daily. It's very nice. With a combination of Rajanyadi Churna, it make wonders. Paranyadi Kashaya, nice. Induganda Kashaya is Agni Deepana and Srodashodana. My guru is having a very vast experience with Induganda Kashaya and Rajanyadi Churna. It's his favorite. While Chanaprasa Kashaya and Rajanyadi is my favorite. Ashtachurna in Kabaja Jwaras and Rajanyadi more in Paithika spectrum of diseases. Induganda Kruda is all advised only when Nirame, Sleshmani, Kshine, Vada Pitotare. If Amavastha is there, avoid Kruda. Kabaja condition is there, avoid Kruda. Nirame, Sleshmani, Kshine, Vada Pitotare. Only in that condition you should go for Kruda. Some of my students, they have in mind that if recurrent fever is that, I should go for Kruda. It's not like that. If recurrent fever is that, do Amaharatva. Make sure that Srodashodana is there. Make sure that Kaba is nullified. Kaba is in the equilibrium. Then it's Vada Pitotara stage. Then you can go for Kruda. Otherwise, better to avoid Kruda. Murtha Dailas, it's a wild field of practice in traditional Kerala Bala Chikitsa. For every disease, we advise Murtha Daila. It's Shiro Abhyanga with this Daila, Shiro Abhyanga with that's a wide, very vast field, so I am skipping it. In recurrent fever, Belashoganda Lakshadi is my favorite. I know I am little bit fast, but due to time limitation, I am winding in the fever management. And any doubt, I'll answer in the interactive section. Is it okay? Because autism spectrum disorders. Otherwise, with this 2 hour, I will finish only a half of the fever management. For my students, I teach fever management for 4 hours, 4 sessions. My student is smiling how I have taught them fever management. So if I teach them fever management very thoroughly, they can manage all other diseases. That's how fever management, it complication management, then focus management, everything comes as a whole package. That's why Jwara Chikitsa is the first chapter in Chikitsa. He was the best teacher. I usually think of him every time, with a vibrant group of students, poking up with answers and doubts each and every time. Blessed he was, I think. Autism spectrum disorders. Common feature is baby is finding difficult to establish a social interaction with the community. Baby is seeing, has a vision, has a perfect audition, but he is hearing everything. He has good memory, he has good, but he is not interpreting, he is not understanding what he is hearing. I have been taking this lecture for more than 70 minutes. I think everyone, I didn't see a sleepy face till now. And everyone, you are looking at me for more than 70 minutes. Anything different? Every minute, anything different? No, the same Roshni standing before you, the same sari, the same bindi. Then why are you watching me? I have showed everything in the slide, and I think I am audible to you. But you are looking at me like something is going on here. Why? Oh, sir, my God, still he is looking so intense. Because we look at your eyes, not you look into my eyes. Because we have to keep that eye contact to get an emotional bonding. That emotional bonding is mandatory for you to attend my class. That emotional bonding will last long for years and years, and you will smile at me when you see somewhere. Oh, madam. That comes out of this vision, this eye contact. You are not seeing anything. After 2 hours of class, I'll ask, if I had worn a bindi, oh, it's doubtful whether she has worn a bindi. I doubt. You are not seeing anything. We are just exchanging emotions. And emotional exchange is a mandatory rule to establish a cognitive process. If I am not looking at you, I am keeping like this and just reading it out. Is it okay? That kills all the essence of the class. Even if I am narrating wonder drugs, you won't be interested. Then you will be looking into others' eyes, some other's eyes. That's how I married my husband during my BAMS stages. If the classes were very nice, I could and didn't have married him. So I exchanged, and I kept my eye contact. That's why I married him. We kept on exchanging emotions. So eye contact is the first and foremost feature for establishing an emotional contact with anyone. Even if you see a cat, you look into its eyes. A dog, any creature, you maintain an eye contact. That eye contact is absent in autism. That kids, they don't need an emotional attachment. They are not attached with anything. So they don't love anything, they don't hate anything, they are not selfish. No stranger, no intimates, nothing. That's a main defect. So the main Milestone in the management is establishing eye contact. Every mom when coming to me say that my son is very intelligent, but he cannot speak. That's a problem, mom. Problem. Somebody is saying that my child is autistic, but I don't believe. Only thing that he doesn't speak. And after a thorough history taking, I asked, can you leave your baby with me and can you sit aside in the other room? Will the baby be irritated? 100% mothers will say that baby will be okay with anyone. He won't search for me. The confirmatory sign of autism. Baby won't look into your eyes. Baby won't need the mother. He won't search for the mother. That a lack of emotional response, a lack of socialization is the mandatory first and foremost sign. Then only comes that communication defect. He doesn't know how to translate the hearing into its meaning. Auditory association area is the auditory area you hear, and association area with the hippocampus translate the sounds into its meaning. It's not working. Baby is hearing properly. The baby is having a hearing he can hear more frequency than you can hear. His audibility range is much more than yours. So he can hear his toys or swinging something in a far more distance than yours. Hearing range is more, memory is more, IQ is more. Super brain theory is coming up with much force because our brain is slowing down at the age of 1.5 years and their brain is not slowing down. Their IQ is coming up and their EQ is getting arrested at 6 months. Emotional behavior areas are not developing. Speech is an expression of behavior. Speech area is lying just near the behavior area. Language interpretation area also just lies near it. Broca's motor speech, everything near that. So behavior area is not for the age and IQ is more for the age. That's the actual issue there. So emotional issues are the, adaptation disabilities are the. So going into the biology of autism, genetic factors are coming into role. Structural and functional more than the structural changes, functional changes of the brain is there. That's our power field. All other physicians go in search for the structural defect, and I am glad that they cannot find any structural defect. And only every structure's MRI finding, it's perfect. But the baby is functioning. So functional defect is the metabolic functions are deranged. Their acne is deranged. Visham acne is the deranged metabolic functions. So metabolic waste, amathadugada is the. It is involving the immune system and environment factors are precipitating it. CNS pathologies are more. Many theories are coming up. It's my favorite topic. That's why even if I make a slide so brief, it goes on. So, on autism spectrum disorders, I will divide it into two. Psychological or manasika features and sharirika features, somatic. Psychological features are the behavioral issue, that functional derangement in behavior, the social interaction issues, perfectly manasika, and communication deficits. And the somatic features are the CNS abnormalities, GIT issues due to that amatwa, then metabolic abnormalities, defective gut-brain axis. Defective gut is the defective bacterial flora in the gut is the gut is unable to digest your food properly because of the deranged acne, and this semi-metabolized food, what we call that? Ama. Acnina apajita. Now that ama in the koshta is having the chance to get into the system, because the gut is leaky gut is the villi has more absorptive property. Usually our villi won't absorb the semi-digested food. Our villi will usually absorb only the perfectly digested micronutrients, but their gut is abnormal, in the genetic background is abnormal, and their gut villi will absorb, has the capability to absorb undigested or semi-digested macronutrients. So this ama is, so I am speaking in terms of Ayurvedic. So this Koshtagada ama is entering into the system. Clear? Now I call it as Dhadugada ama. And now if it's Dhadugada ama, it doesn't have an easy route for expulsion. It's circulating into the body, and this ama will go and deposit in each and every organ which is low functional. Which is a least functional organ? Least functional. Our brain, cortex, who all are utilizing it in its maximum. We keep it sedentary. It gets deposited in the brain, and it gets deposited underneath the skin. So the main deposit areas are skin and brain cortex. Midbrain we are using, our respiratory center, circulatory center, it won't rust. Our cortex we keep it in resting mode. So it will keep in cortex. So Ayurveda views autism as a psychosomatic disorder with a healthy, because healthy mind resides only in a healthy body, where other science, modern science, views it as a psychiatric disorder alone. And we have a strong somatic background for that. We find the Agni Mandya as the root cause. We find the gut leaking as the main cause. We find the Dhadugada ama. We find the Srodoroda. We find the Dhadugada ama depositing in the Dhadus. So we find it's a perfect somatic disease with an expression in the Manasika background. So our concerns in Ayurvedic platform is impaired Agni, leading to defective digestion and metabolism. Am I clear? Impaired Agni, defective digestion and metabolism, accumulation of metabolic waste in the body, that I call it as ama visha. When it's toxic, I can call it as ama visha. This ama visha is altering the structural and functional maturation of dhadus, causing an imbalance in doshas, impairment in the functional level of mind. Now, Jnanolpatti-krama, Indriyartha, Indriya, Manas, Atma. That's why even if the baby is having a perfect Indriya, Manas and Atma, the baby is not interpreting the sound which you are hearing. So, improper perceptive skills or Jnanolpatti, coordinated functions of Manas and Sharira is affected. Now a little bit object or Indriyartha is the baby is sensing that with the Indriya, with a perfect Indriya, but Manas is not perfectly functioning because of the deranged somatic issues. So the knowledge is not getting transformed from the Manas to the Atma. That's why he is not understanding your language. So confirm the diagnosis. Whenever your knowledge is not transformed from the Manas to the Atma, it won't be stored in the Smriti. That's why you don't understand when you are studying in lower classes, when the mom scolds, you will read in a higher voice, oh, no, but you won't understand. Nothing get registered. But you will find everything registered when you see a movie. When Shah Rukh Khan is doing something, it gets registered very nicely. All that dialogues is you remember still now, isn't it? That is Manas in perfect contact with Atma and goes into the Smriti, which doesn't happen when studying usually. So confirm the diagnosis, whether it is autism or not. Confirm whether he is hearing or not. Because he's not speaking, he is not looking into your eyes, he is not having any emotional contact. Can you ask, baby, are you hearing? Can you hear me? He cannot ask. How can you judge whether he is hearing or not? How can you judge? Keep a tuning fork. Keep it like this. Are you hearing, baby? No. Then how can you judge? No. Reflex is only till 3 months, ma'am. Startle reflex is only till 3 months. Morose is also only till 3 months. Parachute again, it's not associated with sound. You cannot check whether he is hearing or not. Do the BERA. Audiometry also, he won't respond. BERA is the best way. BERA is brainstem evoked response audiometry. You will do something like an EEG. You'll keep the lead sticked on the brain, surface of the skull, give a sound source and measure what's happening in the brain waves. If there is any alteration in the brain wave during the audiometry, we can confirm that the baby is hearing. That's the way to assess the audition. Confirm with BERA alone. You can go for metabolic screening test. Metabolic screening test, confirm an EEG. EEG defects are not mandatory, but can silent seizures are usual accompaniments in autism that can trace out with EEG. Imaging techniques like MRI or CT is not mandatory. So my management protocol. Improve the digestive and metabolic functions. Improve the acne. Improve the gut leaking. You will get 15% of result within 2 months for sure. Only thing that you have to assess is whether it's Acne Mandya is Vadiga, Paitiga or Kabaja. Now I think as the protocol for the Shula, you can decide whether it's Acne Mandya is which type. Manage the acne, 15% result will be sure within 2 months. No brain correctives, nothing. Just acne correction is the base rule. Then clear out the metabolic toxins crossing the gut mucosa, that's Amavisha. Then improve the gut mucosal immunity, that is Srodoshodanatva, Amashodana, and then correction of Deepana. Diet regulation, cut off all the Guru Ahara or artificially preserved one, then advise physical exercise, then now only comes the functional correction of mind. Till now I have done everything for the body alone. No methia drugs, nothing. I hadn't touched anything. Now, after having the equilibrium of all these, now I can go for a methia drugs. So each child is unique. Why? Because his Doshic equilibrium, his level of pharma, his level of acne is different. So the disease is tailor-made. I cannot come out with a management protocol for autism. Diet regulations, purification procedures are mandatory because increased level of metabolic waste are the Dushivisha is the concept of Dushivisha is the, so Shodhana is mandatory. Even if the age won't allow for Shodhana, drastic Shodhana, do smaller Shodhana at frequent intervals. Procedure-based therapies are very nice. This Shirodhara going on, and the other one is Kshiradhara and Shiroleba going on. Pichu, Nasya. Just I kept a case for you. My time is limited, so I'll go for the video first. That's his mother holding him. I'll dedicate this for my favorite student Jeevan because he was doing his house surgency during that time. His father is you can see he's not attached to any bun. He's trying to poke his fingers into that electric. Can you see that's my house surgeons. He's fond of pain, so he's trying to climb up. See how he is climbing up? He's not feared of anything. Everyone is in back of him. So, basic 3 features. No emotional attachment, no eye contact, pain seekers. Pain is a pleasurable feeling for them. So he'll climb up on something, just drop down, have an injury, and they laugh aloud. Hyperactivity, temper tantrums, no attachment to the family members, failure to develop peer in relations, doesn't respond if called by name, no name calling response, lack of social emotional reciprocity. See the contrast of the face. See his face, blank face. No, that's another child. Madam is ready for a clap. No. Okay, that's another child. See the emotion from the other normal baby's face. Now my protocol. Deepana Pajana. That's my first step. Gandharvasadi Kashaya with Saindava Sharkara. Kleda was more. So Brihat Rubala Churna was advised. Kabaja Aktimandi I felt in another level. So I went for Ashtachurna and Patyahara was the predominant feature was social impairment. That was my first target. I tried to establish an eye contact. That was my one and only aim, not the language. Even if the mom was complaining of language, my first aim was eye contact. So more Tikshna and Srodha Shodhana drug Panchagavya was used. Mridis Vedam was the Virejana was given. Then after Shodhana, I went for a Shiropiju with Vada Pitta Shamna Shirabala Taila. And Shirabala 7 Avarti was used for Nasya. Then after that Shodhana and went for Shamana Aushadas. Why? Because it was a Pitta, Vada Pitta dominant case. I went for Tiktagakrada. Shweta Shankupushpi is a wonderful drug at having Vada Pitta Shamana property and Methya Rasayana also. Kalyanaga Kashaya was given daily to ensure the Deepana Pachana and Anilomana for clearing up of the Dadugada Amatwa. Suvarna Muktadi Gulika was advised into. Takradara, Shirolepa, and Matravasti. There is one correction. I did Kalyana Krida with Saindava in that. Now, this is the baby. This is the improvement noted. See the eye contact, see the smile. Now he has the name calling response, can follow simple commands, have 2 languages. I didn't address any language. I didn't give any. This is with 1 course of treatment, 2 months. Now his language improved. Did you see any drug for improving the language? No, I didn't give a single drug. Language, Acha, Cheta was the, even if her mom is looking after him, every time he called Acha and Cheta. Because mom, no need to call her because she is in and around every time. And that Cheta was my former house surgeon, not his actual Cheta. Then family attachment improved considerably, enjoys cuddling. Now see his face, before and after. Now see his video. That's he is sitting on my physio ball. Now he is afraid of pain. See, he's trying to hold his mother, afraid that he will fall down. See the eye contact he is establishing with his mom. That's my Yadu. Now, after this, I did my department research for managing of the autism spectrum disorders, because every public authority, administrative authority, they don't need single case studies. They need trials, clinical trials. So with 60 children, so I did a trial. 30 in other group, 1 and other 30 in other group. This is the result which I got. Internationally accepted criteria was used for assessment, like CAS and ATTAC was used. This is the result which I got with speech and sociability, with cognitive awareness and all, and I presented in front of the officials, and we got a project for managing development disabilities for children. We got a 20-bedded specialty ward for managing autism and development disabilities with a funding of 80 lakhs per year. So now we are a team. I have a team with me. I have 2 physiotherapists, I have 2 psychologists, I have 2 speech therapists. We include music therapy, we include yoga, we have a dietitian, and we are a big group now with 4 sub-centers across the Trivandrum district. We are treating more than 680 patients per year with successful results. So let's join hands for a better future. Everything on Ayurvedic platform. Now, this is a small questionnaire for you. After I have a habit of asking questions, that's my big point. A small video. What's the baby suffering from? See, madam. Yeah, muscular dystrophy. That's a Gover's sign. He is finding difficult to climb up. Can you see? Which dosha? We should speak in terms of dosha. Which dosha? Vada is the, for sure. If I go for doing snehana and svedana, is it okay? Think in upashaya level. Muscle is getting dystrophied. CPK is increasing. Thadu Gada Ama is the Thadu Paga is happening. Why didn't you regard that Pitta? I'm sad. Thadu Paga is the, because of that Thadu Paga is Vada is increasing. So respect that Pitta. You should arrest the Thadu Paga. Thadu Paga is going on happening. That's why Vada is increasing. Vada is increasing only due to the Thadukshaya. Prevent the Thadupaga, it won't go for a Thadukshaya. So respect the Pitta in DMD. See when I respected the Pitta. Now a little bit tough job for you. This is a video on seizure, and you should tell me which type of seizure. Dosha. See all the type of 4 seizure I'll show you. Tell which type of seizure. Vadiga Abasmara, Paitiga Abasmara. Just only that. Did you see? You are shaking yourself. Fell down. Mom is very happy. Why? Because he is doing this every 2 minutes. So she got accustomed with that. See? Next baby. That is baby 1. No, ma'am. It's seizure. Not that fast. How many times a minute? Next baby. See the drooling? No. Now he is not having seizure. You come. When I conducted a Viva, internal Viva for my PGs, they couldn't diagnose a normal baby. I kept a normal baby and they said that he was having such problem. This is Falk. His left hand will go into clonus. Can you see? Back. Now the seizure started. Can you see the smacking movements? Focal, only one hand involved. Now full body. Slowly proceeding from focal to generalized. Clue for diagnosing. See the drooling? Was it so fast like the first one? Duration is more, and recurrence is only once or twice a day. That smacking movement is a part of seizure. The eyeballs going up. Tonic phase, see the respiration changing. Neck to one side. Eyes fixed. See the respiration change. Can you see the color change on the lips? It's getting deeper. Now see the eye movements. Now the respiration is eased. Okay. Did you get the dosha? Just don't see the eye movement. Think of dosha. Jeevan has told me to talk only about dosha. She is waking up from sleep and her mother has put her light on. She'll develop the seizure only if the light is on. On EEG, photic stimulation, light stimulation is the precipitating cause. She's avoiding the light. It's in the upper. She's keeping her head down. She's falling down. That's seizure. See. She'll develop seizure only if someone is waking her up with the lights on. Or if she is directly looking into the sun, she'll develop seizure. If something bright, she'll develop seizure. If she is feeling hungry, she'll develop seizure. Okay. Baby one was having which type? That fast one. Vadika. Any pitta and kaba in between? No. Perfect, finalized. Vadika. All these seizures are tridosha with a dominance of vada. I have to agree. Then the second baby. Which was the second baby you forgot her? This one. More on the kabaja side. Because that slowing was there, that grand full body involvement was there. Now, perfect kaba one. That recurrence rate is only 1 to 2. This one, Vatika one, that is SSP case. That is baby had measles and subsclerotic panencephalitis. She passed away. This is perfect Paitiga one, perfect Paitiga, avoiding all the bright thing, perfect one. So, at least I got some very nice answers. So, had a nice time with you. Thank you. Thank you.
Thank you, ma'am.